I'm 34 years old, married, have 4 kids. Joined the Marine Corps, did 5 years there, and then started at the police department. I truly believe what Marine Corps has taught me the most is that we're all a small part of a bigger plan, bigger things than just yourself. My family means the world to me. Everything I do is because of them. Pre-diagnosis, I was extremely, extremely lucky.
So I'm a thoracic surgeon. All I work on is in the chest. It's not the heart or the aorta. There's a lot of different tumors that can occur in this area, but lung cancer, I would say, is about 70 to 80% of my practice, so heavy on the lung cancer. I love what I do. I feel very honored and privileged that I get to do what I do, and one of the big things that brought me out here to St. Elizabeth, what I saw is a real need for patients out here. There's a high incidence of lung cancer in this area. So lung cancer is what we refer to sometimes as the 1,000-pound gorilla. It's really the dominant cancer in terms of lethality, and that's largely because it's found too late.
My symptoms started with kind of pneumonia-like symptoms, wheezing, coughing, shortness of breath, chest pain. Every time I coughed, it felt like somebody was stabbing me in the ribs. So I went back to my family doctor. I had a fever when I came in. They immediately sent me to the ER, St. Elizabeth. When I got to the ER, I got the CAT scan, and that's when they located the tumor on my lungs. It was from the CAT scan.
About 85 to 87% of lung cancer is directly caused by tobacco smoke, mostly cigarettes.
I think a lot of the time you go, when you're a smoker, you think it ain't gonna happen to me. That is not true. That is not true at all. I know that 75 to 80% of lung cancer is smoking related. Whether you're 34 or 64, you don't want somebody standing over you telling you you have lung cancer, and knowing that a lot of the times the prognosis for lung cancer is not very good. And sometimes it gets caught so late that sometimes there's not anything that can be done about it. To lay those cigarettes down, they're not worth it. They are not worth it.
So I think, to me, one of the big messages from Josh's case is the fact that at St. Elizabeth, we have a lot of expertise to offer, and so we can do a complex airway case like he has and have the patients do well. And so we're really set up to take on complex cases.
I get told on Tuesday, I get a call Wednesday that the following Monday to come in and see Dr. Calhoun. When I walked in there, very scared, unsure, I walked out of there going, I'm in good hands. This is gonna get taken care of, and it's gonna be a bump in the road, and I'll be back to doing things the way I was once Dr. Calhoun's done doing what he does.
So my message to patients out there, or just the population at large in an area where smoking's so prevalent and lung cancer's so prevalent, CT screening for lung cancer can completely save people's lives, and they'll do it by detecting it earlier. So I encourage anyone that meets the criteria that those people go talk to their doctors, their primary care doctor, look online, and figure out how to get a CT screen for lung cancer, because you can save your own life or someone else's life.
And I think, if anything, this has been a blessing in disguise for me to realize my physical and emotional health. I need to take better care of myself physically, and I need to let less things agitate me emotionally, because they're not worth it. And it is not, if you love your family, if you have things in your life that are important to you, then you need to lay down those cigarettes.